Ready? Hi, Justin.
Hi.
Hi, my name is Sue. I'm just going to wash my hands. How are you today?
I am good.
My name is Schmeichel. I'm a registered nurse. I'm a clinical nurse leader student, and I am here today to do a cardiac assessment on you. Is that all right with you?
Mm-hmm.
I need to identify you first. I'm going to look at your name badge. If you could tell me what your name and your date of birth is.
Justin Schmeichel, 11/25/94.
Good. So what we're going to do is listen to your heart and check your peripheral vascular system. We're going to start in the neck where we have our carotids, and I'm going to just feel down for this sternocleidomastoid muscle and next to your trachea, and that is your carotid. And feeling one at a time. That's a good pulse. Again, that's a good pulse. And then we're going to look at your jugular vein distension after we listen to your bruit, as long as we're up here. I'm going to clean the stethoscope for that. And what a bruit is just an extra sound we sometimes hear, and we hear it best either up by the carotids. We usually do not hear, like I said, and I'm going to listen to it with my bell. What I need you to do is turn your head away from at the wall first, and then at the door. And while we're doing this, I'm going to have you take a deep breath, exhale, and then hold your breath while I listen in 3 spots. At the angle of your jaw, mid-cervical, and then above your clavicle, okay? Take a deep breath, exhale, hold your breath. Okay, look that way. Again, exhale, take a deep breath, exhale, and then hold your breath. Good. I do not hear anything, and we do not want to hear anything. As long as we're up here, I'm going to do your jugular vein distension. So what that is, and I don't expect to find that on someone like you, but we're going to check. We find it in people with congestive heart failure. We look at the jugular vein here, and I do not see anything here. If I did see something, I would get my ruler, which is centimeters, put it at the angle of Louis, and then take a straight edge, and then measure it across. Another thing you can do in the clinical or hospital setting is use your 3 fingers, because that is 3 centimeters. Again, putting it down there and seeing for the pulsation above. If you do see it flat, you raise the bed to 45, and then again to 90 to see if you can get the jugular vein distension to disappear. One other test we can do is called the hepatic jugular reflex, or now it's called the abdominal jugular. We find mid-abdomen, and I press in. If Justin, if you can look towards the door again, and press in. It's normal to see an initial pulsing of the jugular vein, but then it should disappear. If it stays there longer than 30 seconds, then the patient is showing signs of a possible congestive heart failure. As long as you're on your side, Justin, or laying down, let's get you back up. I changed my mind. So what we're going to do now is look at your color of your extremities and the temperature. Your arms, using the back of my hands, is warm. Your color is tan. You've been out in the sun. They're warm. You're not diaphoretic. Your fingers are pink. Your nail beds are pink, and the blanching or the color comes back quickly. There's no clubbing. Can you put your fingers together like this and see if we can see a little window? And we can, and that's good. I'm going to go down on your legs, again feeling with the back of my hands. The hair distribution is good on both legs, meaning good arterial flow. Your feet are cool to touch. Nail beds, again, fill quickly. Checking edema right away over the tibia. You press in for 5 seconds. And release, and there is none. 1 to 4 is what we're looking for marking, and there is 0 here, so that is good. As long as we're down here, we're going to look at your pulses. You can feel popliteal back here of the kneecaps. Then you go to the top of the foot, in between the big toe and the next toe, and you find the dorsal pedalis on both feet, which is good. Then you go into the posterior tibia, which is good. And then if you lay down real quick, and you would feel the femoral, which is there. Have you sit up, good thing you're young. Get your exercise in. Feel the radial pulses, which is drawn at 2. Again, that's 1 through 5, and 2 is good. Then we're looking at the brachial. If you bend your arm, straighten it. There, again. And that is a +2. Okay, next what we're going to do is listen to your heart. I'm going to listen in each area. We're going to identify the second intercostal space down is apical. And then we go across to the other side of the sternum, and that is pulmonic. And then we go down to the third spot, that's Erb's point. Skip number 4, go to the 5th spot, which is the tricuspid. Then we slide over to the mid-clavicular area, and that's a mitral, and you can feel with one finger the point of maximum impulse, which I can feel. So now I'm going to listen. It may take a little bit to listen, but it's not that I'm not hearing. There's problems. I just like to hear in each spot for a little bit, okay?
Mm-hmm.
So breathe normally. And at the mitral spot, you would normally listen for a full minute, and we want to pulse in between 60 and 100. Your pulse is slow. It looks like you work out, so I'm assuming your pulse is going to be slower. Okay, then one other thing we're going to listen to with your heart is what we look for is a murmur. And what I need you to do is lay down one more time, roll to your left side. Don't fall off the bed. And I am going to listen with the bell and my stethoscope. And I don't hear anything. Okay, Justin, we are done. Do you have any questions for me?
Nope.
Okay. What I am going to do is wash my hands.
Okay.
And if you have any questions, let me know. But I found your exam to be normal. Okay, thank you for coming in. Okay.